Did you know that roughly 1 in 5 seniors are readmitted to the hospital within 30 days of their discharge? Hospital readmissions can be stressful, dangerous, and costly for seniors. Hi, my name is Chris Meem, and today we're going to be talking about how to reduce hospital readmissions. Number 1, create a discharge plan. Establish a key contact who generally will be a family member. In the absence of a family member, you can certainly rely on Freedom Home Care with our case management services. Work closely with the social worker to create the discharge plan. You might find yourself in a dual discharge situation. You might get sent home with physical therapy, occupational therapy, but those are only going to cover short amounts of time. In a dual discharge situation, somebody will also be discharged home with home care that can provide the longer continuous care options. A great example of a dual discharge situation is somebody who has had a shoulder surgery. They will be discharged home with that physical therapy and occupational therapy, but they may not be able to reach up into their cupboards, make meals, have assistance with grooming, bathing, and that's where home care can come in and help with those services. During the discharge, you want to identify the resources. So who will be a good partner for the home health care, and then Freedom Home Care can serve your needs for home care. Next, you're going to want to make sure that you plan for follow-up appointments. This is a great example of where our case management services can come in, as the case manager can advocate and make those follow-up appointments in addition to taking you to those doctor appointments. Number 2, prepare the home. We want to make sure that the home is prepared for you to safely go home. One of the major priorities is looking at fall prevention. With fall prevention, we want to make sure that we're reducing clutter, picking up throw rugs, for example, installing grab bars, and doing a full safety inspection of the home. If you have further questions on how to make your home safe, feel free to reach out to us. Depending on how long you've been in the hospital or been in a rehab situation, there's a couple other things that we want to make sure that the house is ready for. We want to make sure the electricity is on, all the bills are paid, that the trash is thrown out, and it's very important to look at the amount and quality of the food that's in the home. So looking through the refrigerator, make sure that all the expired food is thrown out, in addition to any other food that might be in the cupboards or available to eat. A nice little touch that a lot of people don't think about: bring some fresh flowers into the home so your loved one is ready to be greeted when they arrive. Number 3, physical support. It's important that the medication management is taken care of, whether that's a loved one or Freedom Home Care. Nutrition. We want to make sure that there's plenty of good food, quality food, nutritious food that's ready. And equipment. So anybody that's in need of durable medical equipment such as grab bars, lift chairs, toilet devices, toilet lifts, assisted devices, or any other equipment that your loved one might need. Number 4, mental support. Companionship for somebody that's living alone is so important. So whether that's friends, loved ones that are stopping by to break up the day, to provide some activities, or the companionship that can be provided by a Freedom Home Care caregiver. With companionship, it's important that the senior is able to still feel like they're part of the community, whether that's being taken to a coffee club, card club, or just getting exercise at the mall, walking the mall. All of these things are great examples of where a companion is able to help you accomplish those tasks. Number 5, ongoing support. Staying on top of your therapy with physical therapy and occupational therapy at home, in addition to the care coordination that our case managers or care coordinators can provide for you. We're going to be there consistently to evaluate and monitor any changes. We can help make doctor appointments, and we can report back to the family to ensure that you have the peace of mind that your senior is being taken care of. In conclusion, by doing these 5 things, it's going to significantly improve the chances that your loved one will be able to live at home as long as possible, independently, and in a safe environment. To learn more about working with us at Freedom Home Care, please check out our website at freedomhomecarellc.com.